ADHD is stereotypically associated with disorganisation, forgetfulness, and, let's face it, chaos. Now, while these traits are characteristic of ADHD, they don't necessarily encapsulate the full spectrum of how ADHD can present, especially in females. What is often overlooked is a phenomenon called hyperorganisation. This is where individuals with ADHD often kind of exhibit meticulous, rigid organisational patterns or strategies. Now, what these systems do is create a bit of structure and control, which really helps kind of compensate for the disorganisation and the overwhelm that comes with that disorganisation. Which means that hyperorganisation is actually a protective mechanism. And if we don't truly understand what hyperorganisation is and how that presents, especially in female ADHDers, what we're going to do is accidentally misdiagnose. What that means is we need to recognize hyperorganisation as a coping mechanism associated with ADHD and not brush an ADHD diagnosis to the side just because someone is slightly more organised, because they might have spent years creating that coping strategy for themselves. Okay, welcome to part 2 of the chat about hyperorganisation in ADHD. Now, while hyperorganisation has lots of benefits in regards to providing structure and a bit of routine and predictability for ADHDers, it is not without its drawback. Maintaining that high level of organisation can be mentally exhausting and it can lead to burnout. For many ADHDers, that hyperorganisation is driven by a fear of failure, a fear of letting others down, a fear of things falling apart. And that perfectionistic, mindset can contribute to anxiety and a range of other mental health concerns and that real sense of inadequacy, which is not what and it is in the long term, it can be really unsustainable. It's also really important to understand that hyperorganisation can actually mask other ADHD symptoms, creating that false sense of competency, which then kind of creates this cycle of burnout. It's exhausting. So if you're a clinician and you are working with someone who tends to try and stay really on top of things, but is in this bit of a rut at the same time, trust me, look further into ADHD.